Hello, this is Dr. Lisa Jukes, and today we're going to be talking about vaginal rejuvenation, one of the many services we offer here at Modern Women's Health. Why is vaginal rejuvenation important? As we age, the tissue changes. Now, we also know that some patients are just born with differences in the appearance also of the labia. Some patients have changes from activities such as spin class, or from having children. All these things can change your anatomy a little bit, or you can just be slightly unhappy with your appearance or not feel comfortable in your clothes. Or it could be something where perhaps you have a little urinary leakage. Things don't feel the same with intercourse, or things feel like they might be hanging out a little bit, or you could be leaking urine or having to urinate more frequently. These are issues that with an exam we can help guide you with some treatment options. Oftentimes we get asked, is it painful? Well, our goal here is to make it as minimally painful as possible. Now, some procedures really don't have a pain component. That would be Votiva Forma V, vaginal rejuvenation. Amsella, which is the electromagnetic stimulation of the pelvic floor. That's not painful. You will feel your pelvic floor contract, but it shouldn't be significantly painful, and you might be sore afterwards, similar to if you had a workout, but now we're working out your pelvic floor. And that's the same for V-tone, which is the internal electrical stimulation of the pelvic floor. And as far as painful with Morpheus 8V. So if you've had Morpheus 8 RF microneedling of the face or other body parts, you know that there is a pain component, but we work with you on that. We'll use a combination of oral extraction Tylenol. We might use something like gabapentin ahead of time. If you need something more than that, we can certainly discuss it. And then we're going to use a highly effective topical numbing medication that we will apply typically 45 minutes to an hour prior to the procedure when we're doing the external procedure. Some patients don't need the Morpheus 8V externally. They only need the internal component, which is really comfortable and typically only needs a topical numbing agent for 5 to 10 minutes in the vagina. Mona Lisa Touch, for instance, is quite comfortable, and that may just be an internal numbing agent for 5 minutes and an external anesthetic for 10 minutes. Works really well with that. Some patients don't use any numbing internally for the Mona Lisa Touch. And then the Forma V Votiva that we touched on earlier is a warm wand. It is rare for anybody to have discomfort with that. In fact, some patients might even fall asleep during that procedure. So the O-shot, we work very hard to make that comfortable for you. We use a combination of ice to deaden the area and a topical anesthetic, and then we inject the numbing agent prior to doing the O-shot. So it is rare that we have somebody say they won't complete a procedure because of pain. We've worked very hard to refine those techniques to make it comfortable for you.